next guest has years of experience as an interventional cardiologist with a focus in peripheral endovascular techniques. That's a mouthful. He's been invited to speak at numerous national conventions and conferences, as well as being featured on many magazine covers. Dr. Vinay Satwah, a vascular medicine specialist and medical director with the Center for Vascular Medicine, is here to talk to us about a medical condition called pelvic congestion syndrome. So welcome, Dr. Satwah.
Thank you so much, Julie, for having me. It's a pleasure to be here.
Thank you. Yeah, so break this down. What is that? What kind of syndrome is this?
Absolutely. So pelvic congestion syndrome is a circulation problem affecting mostly females that involves the pelvic area. In females, the ovaries and uterus drain via a very extensive, rich network of veins, which eventually take the blood back up to the heart. If these veins become dilated, damaged, and engorged with blood, they start to pool. And as the blood pools, patients can have pelvic pressure, pain, lower abdominal pain, and even back pain. Julie, this pain can become so severe that it can lead to lifestyle changes affecting daily activity, work, and even personal relationships.
Now, can this pain upon the first diagnosis be masked as something else?
Absolutely. That's the thing. In the United States, Julie, 15% of women between the ages of 18 and 50 are walking around with chronic pelvic pain. What's more alarming is 60% of these females don't know the cause. That means that millions of women are walking around not even knowing they may have pelvic congestion syndrome.
Okay, so then what happens if you don't get treated? You know, what are the side effects? What could happen to you?
Right. So if this is allowed to, it becomes undetected and allows to, worsen. Women can get pelvic pain, pelvic pressure, which can be sharp or dull. Oftentimes these women have worsening of pain during their menses. I've had patients tell me that during their period they cannot even get out of work and get out of bed and go to work.
Which almost is masked like endometriosis, because that's some of the similar
There's a lot of overlap there. So a lot of times this diagnosis is masked by other causes, and so it's not until they come into the office to get evaluated until they find out that that's the problem they have.
So how do you evaluate someone?
So it's very simple. We start with a thorough history and physical. Then we do a duplex vein ultrasound, painless test through the skin. And if that's abnormal or it's inconclusive, we can then go on to inject some dye into the veins.
And
it's called the venogram. That's the ultrasound there that you see. If it's abnormal, we can then do a venogram, which is injecting dye, taking getting a better picture of the veins and getting a clearer look. The beauty is that this can be done in the outpatient same-day setting in our locations.
Oh, that's good to know. Okay, so then how do we treat it?
Treatment is very simple. It revolves around fixing the damaged veins to help with improving the drainage from the area. That can require either injecting medication, placing a stent. Again, this is all done in the outpatient setting in a very comfortable environment.
So when you say vascular, I automatically think cardio. You want to keep that blood moving. You want to keep going. Is that what you recommend? How do we treat this? How do we prevent it?
Absolutely. So it's very interesting. It's fun to watch patients as they have this treatment done, because oftentimes on follow-up, we don't even recognize them. They've lost so much weight because they want to be more active than they can exercise. A lot of them, they cannot have sexual intercourse because the pain worsens during intercourse. And so they often bring their significant others with them who want to come and personally thank us for giving them back their sex life. It's remarkable.
Right. Well, that makes sense, though, because all the blood flows to the pelvic region when you are having sex, so it makes sense if this is where everything is pooling, as you said, and it's causing discomfort.
The veins are already damaged, so they're only going to get worse, and as the blood is starting to pool more and more during sexual intercourse.
So if you go in and you have this, and you're diagnosed and you're able to help somebody, is there a chance of recurrence, or how do we prevent that?
Great question. So prevention, being active, the chance of recurrence is very low. In our studies, over 5 years, there's a greater than 80% chance that women will do just fine, but in that 20%, we can always fix it again down the road if it recurs. But in the time that we've been doing it, we've had fantastic results. And again, it's watching people transform. These are women that are depressed from the chronic pelvic pain that they've had. You cannot even recognize them when they come for their follow-up. They're in such good moods and spirits.
Right, and so are their partners.
Absolutely.
And that's good exercise.
Fantastic exercise.
It's people helping people.
People helping people. I love it.
Vinay, before I let you go, where can we find more information?
Thank you. We have conveniently located offices in Maryland, D.C., and Virginia. Our website is www.cvmus.com, and it's on the screen here. And then please visit us or give us a call if you want an appointment or have any questions.
Great. Thank you so much for joining us today.
Thank you, Julie.
It's a pleasure having you. Thank you. All right, folks, stay with us. We have more of Let's Talk Live coming up right after the break.